Thank you for the opportunity to express our strong support of HB321, and thank you and have a great day.
Thank you, Ms. Sugamo. I'm going to ask, there's going to be moments in that if we could refrain from any kind of clapping or any kind of other additional expressions, that would be helpful, please. We're going to have Dr. Otto up, followed by Dana Ciccioni, followed by Harry Kobojiri, Police Chief from Hawaii County, if he's present, and then the Department of the Prosecuting Attorney. Dr. Otto?
Good morning, chairs, vice chairs, members of the House Committee on Health and Judiciary. Thank you for the opportunity to speak before you today. You have my written testimony, and I just wanted to make some additional comments that I believe are in line with the intent of this bill, which is to expand and improve on access for our patients in Hawaii who have the right to the medical use of marijuana. We've been making steady progress over the past couple of years towards this goal, with the Department of Health now in charge of the administration of this program. Now this bill, which is also a huge step forward for expanding access, which also is in line with how other states are handling this situation across the country, with over half of the states in the union now having some type of laws that provide access for the medical use of marijuana. But there's still one step that also needs to be included in this plan of expanding and improving access, and that is the piece of federal scheduling and the current misclassification of marijuana as a Schedule I controlled substance. As you know, states have the authority to accept the medical use of marijuana, which is why Hawaii was able to create its program in the first place. And this is a unique situation where the accepted medical use of marijuana by a state has impact on federal scheduling. And the Federal Controlled Substances Act was clearly created with a role for states to play in changes in federal scheduling of controlled substances. I just wanted to recommend that three additions be put into the bill. The first, that a copy of this bill be forwarded to the DEA and the Department of Justice upon its approval. Second, that our State Attorney General issue an opinion in support of the state's authority to accept the medical use of marijuana. And third, that the DOH be called upon to file a formal petition with the DEA to initiate rescheduling proceedings for marijuana. I appreciate all of your effort on this very important issue. Thanks very much.
Thank you, Dr. Otto. Next up is Mr. Dana Ciccioni, who's a caregiver on the task force. He's going to be followed by Chief Kubujiri, Department of the Prosecuting Attorney, and Mr. Alan Shin, Coalition for Drug-Free Hawaii. Good morning.
Good morning. Thank you for massacring my name. No, I'm just joking.
How do you pronounce it correctly?
Saccone.
Saccone.
Yeah. Aloha, Chair Bellotti and Vice Chair Rhodes and all other members. Mahalo for the opportunity to testify. My name is Dana Saccone, and I was the designated caregiver on the task force and a current caregiver in the medical marijuana program. I will stand on my testimony and keep it short. Being a part of the task force, I feel these recommendations were put together collectively. They are what we need to help the patients who can't grow for themselves. I support HB321, and this bill will allow patients safe and legal access to cannabis without having to go to the black market and get their medicine. So please support this bill. Mahalo.
Thank you, Mr. Saccone. Up next, Police Chief Kubujiri.
Chair, he's driving from the airport. If we can go last.
Okay, well, let's go to the Department of the Prosecuting Attorney.
Good morning, Chair Bellotti, Chair Rhodes, Vice Chairs, and members of both committees. Deputy Prosecutor Tricia Nakamatsu appearing on behalf of the Honolulu Prosecuting Attorney's Office. We are opposed to this bill as written. The contents of the bill fail to address or even mention a number of major concerns that the department has for law enforcement purposes and public safety. We feel that these need to be considered before giving Department of Health rulemaking powers, and these concerns are listed in our written testimony, so I won't go into those at this time unless there are questions later. Moreover, the provisions that are in the bill Some of them we feel present so many problems for law enforcement that it would essentially nullify some of the limitations that are currently in place for medical marijuana. In particular, there's no mechanism or reference to tracking or limits on the amount of medical marijuana that could be distributed to any particular patient in any given particular time frame. And this is also explained at length in our written testimony. There's no available means that we know of for law enforcement to analyze the potency of marijuana content or THC content, and food products present an even greater problem in terms of potency that can vary widely within a product. And we need to do these cases either for enforcement and or prosecution. There's very exacting standards that we need to be able to meet, and these provisions simply wouldn't allow for that. And finally, most importantly, there's an overarching concern whether dispensaries are even necessary to ensure that all registered medical marijuana patients have access to their medical marijuana at this time. Given that in December 2014, the state's medical marijuana database indicated that there are currently statewide 318 individuals, 318, who are unable to grow their own medical marijuana and don't have a caregiver who can grow it for them. These are spread out across all the various islands, and given those numbers, 318 registered medical marijuana patients unable to grow their own medical marijuana simply does not seem to justify a statewide dispensary system, particularly when there's a mandate in this bill for 26 dispensaries statewide and potentially 30 producers statewide. Even at the ratio of 1 dispensary per 500 registered patients, that it arguably doesn't even justify 1 dispensary, particularly, again, when these 318 individuals are spread out statewide. While we do understand that we're not debating that medical marijuana is or may be appropriate for some gravely ill or afflicted individuals, that's already been established in this state by the legislature. However, we don't feel that this is necessarily the best means of addressing what appears to be the current issue.
Thank you. Okay, up next is Mr. Alan Shin, Coalition for Drug-Free Hawaii, and he will be followed by Mr. Raphael Kennedy, Executive Director of Drug Policy Forum of Hawaii, and Mr. Daniel Gluck from ACLU.
Good morning, Chair Bellotti and Chair Rhodes and members of the committees. My name is Alan Shin, Coalition for Drug-Free Hawaii, and we stand opposed to HB321, mainly because I think we feel that the House Bill 321 does not go far enough in terms of regulating, putting forth regulations that would ensure that there would not be harm to youth. We don't want that. That we would want to prevent big marijuana commercialization in Hawaii. I think that's another one. And the need to further define, is marijuana really medicine? I think we can go further in terms of debating that. I just want to make a comment that the task force, I thought, was run very well. I thought that there was a attempt really to put into place a very complex medical marijuana dispensary and production center system. And I know that Chair Bellotti put in a lot of, I have to commend her for her leadership, and members of the task force, many of them who are here in the audience, for really attempting to put something in place. But I think we need to go further on this. And my recommendation is that we do reconvene something like what we had on the task force to continue the discussion and debate on how we'd best put into place a compassionate and well-regulated system. And also, we'd want to take more time to really involve stakeholders and other people in soliciting input on what kind of system is really needed. That could be a survey of the 13,000 medical marijuana patients that are out there in the state. I think that would be a good practice or a good strategy in order for us to find out what is really needed statewide in terms of a medical marijuana dispensary and production system. And then lastly, I think we need to explore further best practice models from other states. We did some of that in the task force. I think we need to do more of that and to closely monitor what is happening in Colorado and California to avoid any harmful effects of permissive and chaotic marijuana policies. Thank you very much.
Thank you, Mr. Shin. Mr. Raphael Kennedy, followed by Mr. Gluck, and then is Chief Kubojiri here yet? Okay. Good morning.
Good
Mr.
morning,
Kennedy.
chairs and vice chairs. So I wanted to address a few issues. Firstly, we were also very happy with the huge amount of effort, the 22 hours of meetings, not counting subcommittee meetings and conference calls that went into the task force recommendations. And we were thrilled to see a matter that is so important to so many people in the state of Hawaii be taken seriously. The task force did a tremendous job, and we recognize that that job isn't complete. This is one step of a process that moves from a recognition of the fact that we need dispensaries to the implementation and creation of that system. We, in the state of Hawaii, will need to pass a bill, but we'll also need to create a complex system of administrative rules and hire new people and evaluate applications, and this is a long process, and we understand those considerations. But the Drug Policy Forum is concerned that we've already been asking patients to wait for a dispensary system for 14 years. Asking them to wait for several additional years is too long. Language that's in this bill, in 321, should be addressed to compress that timeline and, at the very least, grant licenses in 2017 for dispensaries. We support the intent of the bill, and we support the bill in almost every other way. This is a really compelling framework, and it's the closest we've ever come to really seeing a system that'll actually work. Thank you all for your time. We're available for any questions.
Thank you, Mr. Kennedy. Mr. Gluck from ACLU.
Thank you, chairs and members. I'm Dan Gluck. I'm the legal director for the ACLU of Hawaii. I was a member of the task force as well. I'm obviously here testifying on behalf of the ACLU, but wanted to give a little bit more background on the process that the task force went through. As Mr. Kennedy referenced, the task force met in person for a total of 22 hours over the span of more than 6 months. We also had several subcommittees, one of which alone met for an additional 8 times for, I think, another 16 hours. We had many other conference calls and people working on their own. We had a very, very thorough process. We came up with what I think is a very comprehensive report. The final report itself is over 130 pages. There was a subcommittee report that was another 150 pages. And the report very adequately balances patients' needs against public safety concerns. I do want to address several of the concerns that were raised by both the Attorney General's Office and the Department of Prosecuting Attorney. The Attorney General's Office talked about the number of licenses that would be offered, and I actually agree with Ms. Nagamini on one point. It said the bill right now says that 26 licenses shall be granted by a certain date. My understanding was that the task force actually recommended that 26 licenses would be offered by a certain date. So if the Department of Health can't find 26 dispensaries, it's not on them to go find the dispensaries. They just have to offer a minimum number by a certain date. The Department of Prosecuting Attorney talked about patient limits. Nothing in HB 321 changes the current law, which still sets the limit at 4 ounces of usable marijuana for a patient to possess at any given time. The task force had also talked about a potential ceiling on the amount that patients could purchase over the course of any given month at any dispensary or group of dispensaries. We didn't reach consensus on that item, but I know at least several of the committee members talked about a provision that would provide that patient could not purchase a total of more than 8 ounces in the span of any month. So a patient couldn't go, and buy 4 ounces at one, 4 ounces at another, 4 ounces at another. The patient would be limited to a ceiling of 8 ounces over the course of any 1 month. That was not consensus of the task force, but that was one thing that several members had discussed between themselves. The one other concern that the ACLU has is that, again, as Mr. Kennedy mentioned, patients have been waiting for this dispensary system for over 14 years now. The bill as it stands right now allows the department to start offering licenses as of January 1, 2017, and then mandates that they start by a later date. We would like to see the allowed by date moved up. Obviously, if the department needs more time and isn't ready to start, it can start when it is ready. But I know that Mr. Whitaker and the other folks at the department are working extraordinarily hard on the transition now. I have no doubt they will on the dispensary system as well. And if they are able to start operating more quickly, we would like them to be allowed to operate more quickly. And then the final issue is that the Attorney General's office talked about inter-island travel and how it's prohibited under federal law. As you all know, we can't control what the federal government does. We can't control what federal law is. But we can control what happens here in our state. We can control what the state's response is to medical marijuana. We can make clear in this bill that at least under state law, there's no prohibition on individuals traveling between the islands to provide needed medication for sick patients, and we ask that the committees do so. Thank you very much.
Thank you. Do we have Chief Kubujiri here? All right, members, I'm going to ask that the task force members step forward and have a seat at the table, and that we're going to now open it up to questions by the committee. If staff can assist with additional chairs. My apologies. We're going to work on getting some additional chairs. But with that said, members, opportunity for some questions, and I'm going to allow some leeway with this. So maybe let's see how we can. Let's see what questions we got. Any questions to my right, members of any of the task force members?
Yeah.
Representative Morikawa.
I just wanted some clarification because I can't in my mind envision what 4 ounces would look like. About how much is that? Does any of you, can you kind of size it? No? Like is it a Ziploc, gallon, quart?
Microphone, please.
4 Ziplocs.
4 Ziplocs?
4 Stanley bags. 1 ounce per.
4 quarter-size Ziplocs? Or sandwich bags? 4 no. Thank you.
As we proceed, I would like to ask the testifiers to speak into a mic if they can. If we could flip some of the microphones over, and then representatives, I'm going to ask you to share. We need to have you speak into a mic because we have this being broadcast.
Representative Morikawa, the law as it stands right now is that patients can possess up to 4 ounces in a month, so this bill is not changing that in the least.
No, I'm just trying to imagine what the 8 you're talking about.
Thank you.
Thank you.
Okay, Dr. Cregan, and then to my left, Representative Tupou.
Hi, Dr. Otto. There are a lot of questions raised by this bill and other subsequent bills, but you're familiar with a medication called Marinol?
Yes, I am.
Right, and the main ingredient of that is?
That would be tetrahydrocannabinol, or THC.
Which is also the main psychoactive ingredient.
That's the primary cannabinoid found in marijuana. And as you said, it is the primary psychoactive ingredient.
Okay. And that's available at any pharmacy in Hawaii?
Yes. Marinol is in Schedule 3, both at the federal and state level, which means that any licensed physician with a state and federal narcotics license can write a prescription, a refillable prescription for a patient that could be filled in any pharmacy in Hawaii.
Okay.
The first problem with this is that it's a synthetic form of THC.
Okay.
And as you know, synthetics are never 100% pure.
Okay.
There are impurities in there.
Okay, I'm going to cut you off there.
Oh, sorry.
But no, thank you, because we really good. Thank you so much.
Representative Tupuola, and on this side next, any question? Representative Brower next.
I have a question for Mrs. Lopez. One of the...
I'm actually Ms. Nagamine.
Ms. Nagamine, sorry. Your statement was about the minimum number of dispensaries is premature to determine at this point. Was that correct?
Yes, that is.
And so can you expand, should it just be done away with the number and that would make it better, or it should be set to a minimum, a smaller number? What is, I understand because now they gave the number of how many patients are actually...
We were just thinking that it makes more sense if you're going to give the Department of Health the licensing authority over this, to wait until the Department of Health determines what's necessary. And that would be something that they can figure out by how many applicants they get for licenses.
Yeah.
Eventually, after they start the first dispensaries, they're going to figure out, the dispensaries will be saying, hey, we've got way too much, or wow, we're not even beginning to meet the demand. They're going to be getting information from that. So rather than tether the department to either having more than they would need or not enough,
set it for the supply and demand.
Let the department establish that by rule.
Okay, thank you.
Before Representative Brower goes, I want to point out that at the table with us is Mr. Whitaker, who has done a yeoman's job of bringing up the program and transitioning from the Department of Public Safety to the Department of Health. So we want to recognize that he's also here at the table and has done a tremendous amount of work. Representative Brower.
Thank you, Chair. And if I may, a few brief questions to the best qualified person to answer them. And I think a lot of us support the aspect of getting a type of substance medicine, someone who truly needs it. Unfortunately, what I and many are worried about is that the few will ruin it for the many. And we see that today with marijuana, at least I see that just in pop culture, as well as alcohol. The bill says that there may be 13,000 qualifying patients, yet the prosecuting attorney's office said, give a number of 300, and I know the definitions are a little off, but why do you have 13,000 qualifying patients in the bill?
I'm Peter Whitaker from the Department of Health. We run the marijuana registry program. For any patient that wants to be part of the program, they need to be certified with the Department of Health. We've had the program only since January, but we have approximately 13,000 patients statewide at the moment. So that's a pretty good idea.
Who qualify or who are
qualified and have their cards, so they are
to purchase. And how hard is it to obtain a card?
Not to purchase. They are not qualified to purchase. They are qualified to
obtain,
grow their own, or have a caregiver grow for them. So there's no legal way to purchase at the moment.
Okay. And generally speaking, what's the prerequisite to obtain the card?
You have to have one of approximately 10 qualifying debilitating conditions that are in the statute. And the physician needs to certify that the patient has one of those debilitating conditions and that the benefits outweigh the risks for the patient.
And Madam Chair, if I may, why couldn't marijuana be flown in and then dispensed at a central location? So not necessarily the structure set up to grow in Hawaii.
I'll take a shot at that one. Flying marijuana between islands and certainly from other states is highly problematic in terms of federal law, and I think there's attorneys here that can talk to that issue. But more importantly, it's an issue of access for patients. if patients are to be getting their marijuana on a regular basis for medication, it needs to be relatively accessible. Now, the equivalent would be getting Tylenol or other medications in one store in central Oahu and expecting people from neighbor islands or the surrounding areas to get it in one area. So I think it's important. These are patients. This is a legal use of medical marijuana, and it needs to be accessible if it's going to be successfully used by patients.
Thank you.
Thank you, Representative Brower. I'm going to ask Representative Hashem, Representative Jordan, and then Representative Thielen.
I guess this would be for the prosecuting attorney. It sounds like you guys are for medical marijuana, but you just don't like the bill because of the flaws within the bill.
Yeah. If you look at a lot of our testimonies by various people with concerns, we're saying treat it like a pharmaceutical drug. So, like other pharmaceutical drugs, you don't see them manufacturing or allowing them to create their own drugs. You have to go to the pharmacy and get your doctor prescription. So treat it like that is what we're saying.
Can you get us language then? Because one of the committee's main goal is to craft this legislation.
Yeah.
So you did a really good job of saying what's the flaws in the bill. Can you give the committee what you would like?
Sure. In our testimony we itemize it. We can actually go line by line in another testimony, but we itemized subject matter wise of the bill that has concerns. The other thing that Deputy Prosecutor Trisha Nakamatsu brought up is with a market. I mean, some of us are in business in our private lives as well. You want to look at supply and demand. If your demand is so small with only 300 people that's going to be unable to get it, and you have a market that's growing its own, how competitive will that prices be in comparison to the dispensary prices? Because now they're harvesting and then they're grabbing seeds and then regrowing it, versus the dispensary. How will that price warfare in the market affect having growers? We're saying make it like other pharmaceuticals where it has to be gotten at through a regulatory scheme, hospital scheme, and also pharmaceutical scheme, and maybe not have growers if this bill passes.
Well, can you get us language then? Can you write us an HD1 of your?
We could work together with various individuals and come up with it.
That's what I'm asking for. Instead of just saying this is bad because of this, could you get us some language that we could actually, so you guys would feel comfortable with it? And Alan Shin,
yes.
Does Drug Free Hawaii oppose medical marijuana, or do you oppose this bill?
No, I think we, from a prevention point of view, we question whether marijuana is really medicine. And I think we need to, that in my testimony I said that we need to really define that better. There are a number of new drugs that are based on CBD, the component in the marijuana plant that people think is going to be therapeutic and beneficial to address some of the medical conditions that we're seeing. But the rollout is probably another 2 years away. Once that comes, though, I think that's going to revolutionize how we see marijuana as a medicine. So it's incomplete, and there's a lot of questions about marijuana being effective right now in the smoked and edible form.
Okay, thank you.
Representative Jordan, followed by Representative Thielen, and I'm going to then defer to Chair Rhodes.
I'm not quite sure who to address this to. It's already been stated there's about 13,000 card holders. In the prosecutor's attorney, you're saying 381 are identifying as not being able to be growers. How did we get that statistic, and do we actually keep stats of who can grow and who cannot grow? Do you guys keep a questionnaire or something?
I'm Peter Whitaker again with the Department of Health. We do not know actually how many people in the state can or cannot grow their marijuana, but it's a fair assumption that if you cannot grow marijuana or you cannot find a caregiver that can grow for you, there's probably not much reason to get a license with the Department of Health or get a permit with the Department of Health. Typically what happens in other states is when the dispensary system is available, that means the medication is more available to patients, and a lot more people come out of the the back area and come into the forefront because they realize that they can obtain their product. It also often makes physicians feel more comfortable in certifying their patients because they know that there's a potentially illegal way that they can obtain their medications. We do not know exactly. That's a fair statement. We do not know exactly how many people cannot grow their marijuana. But there, as I think we see here on the panel and listening to patients, there's a very significant number that cannot grow, or they cannot grow enough, or they cannot grow the species that they want, and they cannot grow marijuana that has been tested in laboratories. They're not really sure what they're getting. So I think there's a whole range of issues, and it's not just whether you can grow it or not, but can you grow the right medication for the right purpose and the right quality for the patient.
And Rep. Jordan, if I may, so the numbers that we had indicated were taken from the state's medical marijuana database, which I believe was maintained by the Public Safety Department. I'm not sure, but those were current as of December 2014 is my information. Also, with regards to the numbers being what they are, we hadn't, as far as the people who are unable to grow the type that they want or to the efficiency level that they would like, I don't know that to what extent the committee or the legislature has explored things like just providing training for the caregivers and the patients that currently exist.
Chair, may I? I have a couple questions for the AG.
I'm going to move to the Representative Thielen first, call Chair Rhodes, and then see if any others, and then we'll cycle back. Representative Thielen.
Thank you. We all saw the young mother that was here with her daughter. Is there a way that particular product could be made available much sooner rather than waiting for 2017? I mean, that just seems almost heartless that we are leaving her without the access to what she needs. And it doesn't look like a large body of people that would need this, but I would imagine Department of Health has some sense of how many young children are epileptic. So could you respond to that? Because I think a 2-year delay is quite heartless.
I'm totally with you there, Senator Thielen. We haven't found a way to do it. We are operating within the confines of the law at the moment. We don't know exactly how many patients are in that condition, but we would certainly try to find out. But my guess is there are many other very compelling cases as well for other conditions. And I've just finished public hearings around the state, and I'm so impressed by the people that come forward and talk about how compelling their medical conditions are. We will certainly do whatever we can to implement the intent of a bill for dispensaries or some other mechanism as soon as we can. So we're conscious of the issue.
So if we were to amend the bill to say no later than the 2017 date, then if you could move quicker, you could implement the dispensaries, right?
You know, I think we are going to do the best job we can to get a good program in place that everybody can feel comfortable with as soon as we can. There's no intent to delay at all. So an earlier possibility date I think would probably be fine.
Thank you.
Before we go to Chair Rhodes, I'd like to welcome Chief Kubojiri to the table. He was the Law Enforcement Coalition representative on the task force. We do have his written testimony. And Chief, welcome. Thank you for joining us all the way from the wonderful, beautiful Big Island. We're in the middle of questions, so we do have your written testimony, and I'm going to indulge in questions from Chair Rhodes at this point.
Okay. Well, first, my first question was about the 318 number that the prosecuting attorney brought up. So the argument, I think, in your testimony, Ms. Navarrete, was that since there's only 318 and the ratio is supposed to be 500 to 1, we don't even need one. I guess I'm a little puzzled by that logic. So there's 318 people, at a minimum, there's 318 people who are eligible for medical marijuana, but that doesn't justify having even one dispensary?
Arguably.
What's the argument?
Because they're distributed statewide. It's not as though even those 318 people are all on one island. Those are across statewide. I believe Honolulu had 221, Maui had 78. There was 12 on the Big Island, 6 on Kauai, and 1 on Molokai.
Okay, so
So
how do you propose to provide the medical marijuana, a program that's been legal for 14 years? How do you propose to...
For people who don't have access?
Yes.
I'm not certain to the extent what other alternatives the legislature has considered. I would imagine they've touched upon many or all of them over the past 14 years.
Okay, let me ask a different question. So they're on different islands, and it's already been pretty well established by you and others that the federal government, it looks very unfavorably upon people transporting pakalolo on flights. So except for the exception of Molokai and Maui, where you can conceivably, you could take the ferry over, you'd have to fly between these different islands. Even if you had just one to cover the 318, wouldn't you have to fly between? So wouldn't this justify, I guess what I'm getting at, wouldn't it justify at least one on Oahu, one in Maui County, one on the Big Island, one in Kauai at a bare minimum to cover the people who aren't getting?
Chair, to my knowledge, there are existing marijuana plants on every island already, and I don't think there's any reason why seeds from the existing plants couldn't be through some other
But
mechanism
wouldn't that require
shared with
that you
people who don't have, and people who don't know how to grow could either be provided with whether it's voluntary caregivers or people from the community who would be willing to sign on as a caregiver, and or additional training to help people learn horticultural skills.
I guess I would have thought that would have happened in 14 years already, because if people need it, then...
I would have too, but apparently there's still a need.
Okay. Okay, I'll defer till later. You can cycle back to me some point. Thanks.
Okay, Representative Oshiro.
I'm going to ask just a couple of questions. But first of all, let me thank everyone for turning out this morning. We appreciate it. It's our job to hear from the community. So both proponents and opponents, I thank you for your time coming out. I want to ask a question to those at the table, those who served on the task force, as well as the different interest groups represented here. I think we all have the common goal of providing relief to those who need it, currently are regulated and are licensed under the current laws. The question I have today is that under the current licensing scheme today of the 13,000 permittees or licensees out there, how are they monitored as far as compliance with the current law regarding current possession of product and or immature plants and or mature plants? Can anyone answer that question?
Mr. Whitaker, I think you're the best one.
I'm not sure I am the best one, because it's really law enforcement that really enforces the law. What we do is we certify the patients to be able to grow the marijuana 7 plants. If they do not have a permit or they grow more marijuana than they are permitted, then law enforcement takes a very active role, and I've certainly heard this in all areas in following up and making sure that they obey the law.
Attorney General's office, are you aware of the current enforcement regime over the last 10 years? I think it was the Department of Public Safety. Have there been any incidents of anyone violating the limitation on the number of plants that may be grown or the number of finished marijuana product that can be had?
I don't know any statistics on that. I also don't know whether there's been any concerted effort to go after certified qualified patients to see if they're following the law.
Yeah,
if someone is caught within a law violation and they have more than they are supposed to have, then they probably have has some law consequences.
Maybe Chief Kobojiri, are you aware of the current enforcement of the current regime, grow your own, grow at home, and possess and smoke at home?
The current new meaning, all I can refer to is last year when it was under the Department of Public Safety. Okay. Yeah. Experience, and again I'm speaking just for the Big Island, we have had, there is no one that is specifically tasked with monitoring those that have medical marijuana cards and their grows at home and or other places. We have, though, come across numerous cases of people growing in excess of that allowed by statute under the medical marijuana program.
Okay. Is the auditor's office here? Yeah, I have a question. I think you mentioned that in your written testimony that the current draft before you, 321, seems to address any and all concerns per the auditor's report. Is there anything that's missing in this draft that you would want to see?
Again, when we were asked to do this work, it's a statutory requirement. We're given a bill, last year's bill. We did raise some of those issues, and as far as we're concerned from a licensing standpoint, we look at it against statutory law, so that would be the Regulatory Licensing Act, 26H. It seems to address the policy statements that are in that requirement. Those are the legislature's policies on licensing.
Does the current draft specifically grant the revocation and suspension powers to the Department of Health?
I believe that one thing was something that we had recommended, and I believe it doesn't quite have the specificity that would be better to have for the department's purposes.
Okay. Yeah. Thank you.
Mr. Representative O'Shea, we're going to move to Representative Takayama, and then we're going to go back and see if there's others, and then we'll cycle back for the next round of questions.
Thank you.
Thank you, Chair. I had a question for the Attorney General's office, Ms. Nagamini. The bill as drafted does not contain any limitations on how much marijuana a person may purchase at a dispensary, nor does it describe any kind of limits on, at any one time, how much a person may possess. I know this was discussed at the task force level, but there could be no, we didn't come to a conclusion or recommendation. So I'm asking the Attorney General whether you have a recommendation for limits on purchase and possession amounts.
Well, I sat on the task force too, and I know that this wasn't resolved. I know the current legal amount that you can have at any given time is 4 ounces. I don't think this bill addresses what happens when your 4 ounces is gone. I think when your 4 ounces is gone, you go back to the dispensary. I think if your 4 ounces is gone in 1 hour, you go back to the dispensary. I think if that 4 ounces is gone in 1 hour, you go back to the dispensary. This bill does not make it clear when you can continue to buy more.
No,
but I don't think you can blame the dispensary so much for that. Our doctors are not able to tell the patients how much they need. If you go and you buy a prescription drug at a pharmacy, they're going to tell you take one a day for 30 days. And it's going to have the exact amount in that pill. And that's one of the things that our task force wasn't able to come up with, because that's something that's between the patient and the physician. And there's not a lot of information available even to the physicians, because there aren't a lot of studies that tell you exactly what strength, how much THC, how you should take it.
I understand your point. Thank you. And I'd invite any other member of the task force that is sitting at the table to offer a recommendation as to how much should be legally purchasable or possessed by a marijuana card holder at any one time.
If I could make first, and then Mr. Dr. Otto.
Thank you, Representative Takayama. The task force had discussed this issue, and again, the current law is that a patient may possess 4 ounces at any given time. I think the law can remain 4 ounces at any given time, but if you're looking at an aggregate amount that a patient may purchase at a dispensary over the course of, say, a month, there was at least some movement among task force members, although we didn't reach a full consensus in our final meeting. There was some movement to say, all right, a patient may purchase a grand total of 8 ounces over the course of any given month. And I believe that the Department of Health's intention is to set up a database that dispensaries can check to ensure that the patient is still a registered patient and could track the amount that the patient had purchased. So a patient couldn't go from one dispensary to another, that there would be a summation of the aggregate amount that the patient had purchased at any given time.
Dr. Otto, and then Mr. Ciccone.
If I could just address the issue of being able to provide efficacy for the medical use of marijuana for a patient, under the ideal situation, the physician would be deciding and determining with the patient how much they need to properly treat their condition. And that changes vastly depending on the individual patient and the particular medical condition. So the best situation would be where the doctor determines how much the patient needs per month, and that's something that could change depending on the fluctuation of the patient's medical condition. And then that determination could somehow be made available to the database that the dispensaries are able to tap into, so that the amount that the patient is using is tracked across the state. I can tell you from the patients that I work with that I have a very good idea of how much they need, depending on the strain and the strength of the material that they're using and their condition. And that's something that we are supervising within the bona fide doctor-patient relationship.
Mr. Ciccone, and then Chief.
My name is Dana Ciccone, and I wanted to address Representative Thielen's problem with thinking, how can we help someone like Jerry right now with having medicine, and changing the caregiver-patient ratio would be something that if we could do this year would make a difference in her life, and that's HB 1455. And
Mr. Ciccone, the question is about the patient dispensing limits, so if you're not going to stay on that question, I'm going to ask Mr. Chief Kobajiri.
That's fine. I just wanted to let her know because I wanted to answer it earlier.
Thank you.
Thank you.
Chief Kobajiri.
With respect to the quantities a patient receives, if the dispensaries were the sole place where a patient can get their medical marijuana, tracking of it could be somewhat accurate. However, if you allow people to continue to grow their own medicine and purchase marijuana, there's no way to accurately track how much medicine they are receiving and or ingesting at any given time. So theoretically, a patient could grow and possess 4 ounces of marijuana and go to the dispensary, purchase 8 ounces of marijuana, and then there is that you lose that doctor-patient care aspect of regulating how much medicine this individual is consuming.
Thank you, Chief. Okay, we're going to move on to the next series of questions, and I believe Representative San Buenaventura.
Okay, my question is for the prosecutors. Okay, I believe that we all want to regulate this like a pharmaceutical drug, except that because of the federal law, we cannot get FDA involved. Is it your position now that patients cannot grow? Because we cannot, they won't be able
we want them to
manufacture?
access. So like Chief just mentioned, if this is the bill that's going to be the vehicle, we can actually make it better by making it like a drug, like a pharmaceutical drug, and make it accessible to all. But looking at, we have problems in the rural areas for access to healthcare or equipment, but we don't mandate certain amount of hospitals in a certain region. Here, you're mandating 26 dispensaries. You're mandating certain regions to have dispensaries. So, yes, we want to have supplies out there, but this is overboard as far as having a mandatory minimum.
Okay.
You know what I mean?
Okay, you heard Mr. Gluck's amendment that it should be offered and not make it a mandatory minimum. Are you okay with that?
I have to check back with my department and the law enforcement coalition, but like Chief said, we want to make sure we can track it. Like in our testimony, tracking is important.
Okay.
With a system like this, we could track better.
I believe the reason for the requirement of at least 26 or something, and I may be wrong because I wasn't part of the task force, was that if we make the dispensaries very limited, then we limit access, which is the big problem we are having now, as well as it would make prices so prohibitive because then there would be like monopolies. So I'm assuming...
Thank you, Representative.
I'm sorry.
Representative Kobayashi is the only one who hasn't had a chance to ask questions, so I'm going to ask him.
Did the good and hard work of the task force
change anyone's mind or opinion or position? I mean, did it?
Representative, I will say that I learned a great deal about how...
Did you change?
I think, well, to be perfectly candid, Representative, I personally did not come into the task force having a set idea of, I want this number of dispensaries, I think it should be set up in this way. I came in with the idea that patients have been waiting a very long time for a safe and legal way to access their medicine. I come out of the task force still maintaining that belief. As for the structure of how to do it, I think we had a lot of great discussions along the way. I think we've come up with a comprehensive list of recommendations that makes a lot of sense to balance public safety with patient concerns.
Anyone else want to respond? Ms. Sugano. This is.
So, Representative, I think I'm a changed woman. I came into the task force wanting everything. I wanted every product imaginable. I understand that people need more than 4 ounces because some levels within the plant are less than 1%. So you're going to need more quantity to get that final product that you want. Some people juice. You need 99 plants to juice if you're going to do it properly. I wanted everything under the sun. Yet I also understand at the table that it's a partnership, it's a compromise. It's not black or white, and it's not a debate. And so I did leave the group a changed person, I believe. I think we need to compromise and to put things in a 10 milligram THC single serving dose is something that I believe we compromised on. The individual wrappings that are going to be required if the dispensary passes so that each person has to dispense their medication in individual single serving sizes is another compromise to advance public safety and youth access. So I believe, we change along the way, we grow, and I think, in order for this to move forward, we need to figure out how to not just be set on our specific circumstances and what we want, but yet figure out what's best for the whole state. So thank you.
Okay, we're going to go through one more pass-through for questions for the members, if they so want. So Representative Tupola.
Thank you. For the Attorney General and possibly for HPD, the question was posed that it doesn't address law enforcement concerns. I already heard 3 so far, so you're mentioning about people growing in excess when they have been given that permission. Secondly, the mixture of dispensaries with the growing. Is there any other things that, besides that you specifically believe, briefly, that doesn't address law enforcement concerns?
Were you asking the Attorney General?
Anyone.
Chief Kubajiri, I think you're probably best suited to answer that.
I'm sorry, that does not concern law enforcement?
No, my question was, in the testimony they said they don't believe the bill addresses enough law enforcement concerns that they have with passing this. So specifically, besides what was mentioned so far, what other concerns are there in regards to law enforcement that's not being addressed in this bill?
One of the, and I apologize, I arrived late, so I didn't hear much of the testimony. But I've just returned from Washington, D.C., attending a conference which medical marijuana and the legalization move across the United States was part of the subject matter. I also attended a conference in Colorado 1 year after the effects that it had on its community. One of the major concerns that had been expressed throughout was the extraction of THC from the plant matter to get what we commonly refer to as BHO or butane honey oil or the hash oil. Colorado itself had experienced 30 plus explosions within residents. My island itself had an explosion approximately 2 years ago where there was a death and someone seriously injured. So those are issues in short. Another issue that, as far as public safety and the safety of the community, that concerns me. And real quick, another one that was mentioned consistently throughout the conferences I've been through from people all across the nation is that the juveniles having greater access to it. More kids are getting expelled from school in Colorado. And quite interestingly enough, they did another poll in Colorado just recently, and over 50% of the citizenry had voted or had indicated that if they were given that vote today, that they would vote against such measures as making it so accessible.
Thank you. Representative Brower, and I'd like to acknowledge that Representative Chris Lee from the Waimanalo, Lanikai area is also joining us. He's a member of the Judiciary Committee.
Okay, thank you, Madam Chair. To anyone on the panel, and I'm less concerned about who or why people may be smoking marijuana. I'm concerned about this bill opening the floodgates in some way or contributing to lawlessness. That being said, in a more practical reasoning, what would this look like? Would you be treating marijuana cigarettes like cigarettes and not allowing people to smoke publicly? I know it's mentioned in the bottom of your bill, but if this is for a medicinal purpose, would we be smoking marijuana in public?
Can I? So I'd like to, first of all, address a thing. I think there's a certain conflation between the legalization of recreational marijuana and the implementation of dispensaries for a medical marijuana program that already exists in the state. What we're talking about is not something like what Colorado and Washington have. We already do have a medical marijuana program here with 13,000 patients that are already consuming marijuana medically. There is a prohibition on using cannabis publicly, and for some people that does pose a hardship. But what we're trying to do is to balance the needs of the individuals with ensuring the welfare of society as a whole.
And the legislature, and sometimes I feel that my arm's been twisted, we've banned smoking everywhere. So what if you're in a public housing project, or the legislature is close to possibly trying to ban smoking in condominiums? So if you can't smoke in your home, if you can't smoke a cigarette in front of your child in the car, would you be smoking a marijuana cigarette in front of your child in the car?
One thing that I would say is marijuana is not a substance that can only be smoked. So there are a lot of different ways that people ingest it. For some people, smoking it is the most effective. If you have acute symptoms...
I think scientifically it's the most effective.
Well, for some,
Oh, okay, I'm going to cut off this line of questioning. We need to really focus, and I would like to remind my members that this is House Bill 321, and we're looking at the provisions for a dispensing system for medical marijuana. I'm going to look on this side of me. Is there anyone with the second set of questions? Representative Oshiro.
Thank you very much, Chair. I appreciate the indulgence. Attorney General, how does this current draft square with the federal law and the current Department of Justice or Department of Attorney General memorandum regarding the state's regulation of marijuana?
The Department of Justice has issued some advisories about what their federal law enforcement priorities are. Protecting children, making sure diversion of the product doesn't happen. They don't want the product to get within drug cartels or organized crime. They want to protect the public. Important safety issues that I think we can all agree on. But here's the thing. The Department of Justice doesn't have a lot of funds to enforce these things. And historically, they've left the enforcement up as a partnership between the feds and the states. But now many states, not just Hawaii, have legalized the use of marijuana in one form or another. And Hawaii, medical marijuana is legal according to state law. If the feds don't have resources to come in and enforce the federal law, and by federal law we're talking about marijuana is a Schedule I controlled substance, which says it's a dangerous drug. It says it's illegal in every way, shape, or form. Whether we agree with that personally or not doesn't matter. It's illegal federally. So our state laws that make it legal do provide a defense for state offenses. But if you're caught on federal property or in federal waters, and I do need to agree with something Mr. Gluck said earlier, you can't impose so much restriction on travel, and it's not the Fed's restriction on travel or air travel or even sea travel, Representative Rose. It's the international waters where the state protections aren't there. So if you've got somebody who has a violation here in the state on state property, our state law is going to kick in with as much strength as it can. But if we're doing something that the Department of Justice has the funds and resources to come in, there's nothing our state laws can do to protect people in
Thank you,
this
Chair.
area.
I have one other question. For the task force members, we know that there are other states that limit the production and distribution, and basically tie the production and sale off the licensees or permittees or cardholders, such as Arizona, Delaware, Maine, Minnesota, New Jersey, Rhode Island, Vermont. They have very constrictive systems in place where they provide all the marijuana and the marijuana-type products for their patients at a particular center or distribution point. So they narrow it down. It's not as commercialized as we might look at in this current draft. Have you folks looked at that during the task force discussions? That's one question. The second question is this. Certain states also try and take the profit motivation, maybe lead people to do the wrong thing, and looked at only not-for-profits, being dispensaries or production centers. Have you folks considered that? Was there a consensus reached on those items? And third, have you all looked at this excellent report by the Hawaii Legislative Reference Bureau? Okay, because upon this and other similar type documents, we'll be making our decisions. So let's get some, common data points we can all work from. The question, please.
Representative, I can address the issue of nonprofits. The task force actually did recommend a nonprofit structure. We had very helpful input from the Department of Tax throughout our task force meetings, and essentially there's no real difference between having it as a for-profit or having it as a non-profit, but for the fact that a for-profit can distribute dividends to shareholders, whereas a non-profit cannot. From a regulatory perspective, the consensus was that it was going to be easier for the Department of Health to regulate one type of entity, and so the consensus was to make them non-profit entities.
Non-profit or for-profit?
Non-profit.
Okay,
but essentially from a
current draft says for-profit. It doesn't say not-for-profit.
Okay, I think that let me go back and check at least the task force report, but my understanding, and Mr. Shin is nodding his head as well, was that our consensus was that they could be non-profit. But again, the only functional difference between a for-profit and a non-profit is that a for-profit can distribute dividends to its shareholders, a non-profit can't.
Right, like any other publicly traded commodity.
But otherwise, they're the same.
Right, thank you.
And as for the report from the NRB, that's an excellent document, and that was the foundation document that was used by the task force. So it was very well used, very well read, often looked at. We did check out programs in other states. We had conference calls with the directors of medical marijuana programs in other states. We had individual calls. So we really did look at the models in other states, which vary significantly.
Yeah.
Okay, any other second questions? Representative Jordan?
AG, my question revolves more around, normally in the world we live in today, this is a cash economy business. So have you guys looked at that cash economy business and actually bringing in whoever's going to do these dispensaries? How are they going to handle their financing, since there's some major issues with federal banking and cash economies that derive from the faux pas of this as being an illegal drug? So was that discussed, and is that going to be implemented somehow into this measure to help those dispensaries, especially with their financing and bringing them up to speed?
The task force went into that, and I don't recall any solid, concrete resolutions to that, because it is a problem. The banking and how they're moving the money can be a problem, and so I'm not aware of a solid, concrete resolution to that right now.
Thank you very much, Sharon.
Go ahead.
Okay, I just wanted to say that again, we can't really affect federal policy on these issues, but we did in conference calls with both Arizona and New Mexico. That was a question that was addressed sort of broadly. Has this cash economy business been a problem? Has that led to crime or or anything like that with these businesses, and both of them said that that had not been a problem for them.
Chair, if I may, I'm not worried about the crime section. I'm worried about how they can get financing, how they can get loans, how they can stabilize as a business itself. I'm not even going to talk about the profit, non-profit. Still, at the end of the day, we need to make sure they're a viable operation. They're going to stay in business because we need our patients to be able to go to those dispensaries and they stay open for them.
And I would respond that there is now and growing a sector of people offering financial services specifically geared at medical marijuana. People understand that this is a need, and just like any financial services industry, they're trying to serve that need in ways that people need. So there are investors available. Just because there are certain banking restrictions doesn't mean that this hasn't been resolved in other states.
Thank you very much, Chair.
Thank you. Dr. Cregan, and then any second questions on this side?
Thank you. My question is a pretty brief one, but I'm not sure if the Attorney General or Prosecuting Officer, whoever would want to answer this, but right now in our state we have marijuana in Schedule 1, and given the fact that we are approving it as a medical drug, don't you think we should remove that inconsistency, at least for our state? I know it won't affect the federal, but at least for our state, shouldn't we remove that inconsistency? Want to answer that?
I don't have an opinion on that.
What? How would you?
Just our understanding that every year there is actually a bill that intentionally makes our list consistent with the federal, because there is such motivation and justification, of course, for keeping our controlled substance list is consistent with the federal list.
Even though it's approved for medical marijuana?
Okay, I'm going to cut off this line of questioning because this is going beyond the dispensing bill that's before us at this moment. I'm going to allow the last question. Is there any other second questions on this side? The last question to be asked by Chair Rhodes.
Well, all the pressure to have to ask the last good question.
Well, to this esteemed panel on the other side of us.
Well, I guess the question is, when we were talking before about the source, when we were talking about in the bill, you could still grow it yourself or have a caregiver grow it, or you could buy it from the dispensary, and we were talking about the actual amount. But it seems to me like there's a third source, and that's the illegal source. And if we, no matter what we do, if we say, okay, you only get to carry 4 ounces around with you on this of this stuff. Anybody who wants to top, for me it sounds incredible that anybody would be able to smoke that much of it anyway, but if you could and you needed to for some reason, if you were in extreme pain, for example, why couldn't, there's no reason that you can't just go buy on the black market. I'll open that up to anybody. Is that not correct, that you can top it up? You can top up the legal sources with an illegal source if you're bad enough off that you're willing to take that risk?
I would just comment on that, that the same thing is occurring with prescription pain medications, Vicodin. It's a national disaster right now, and you can buy all those on the black market. So I think that there is potential for abuse with any system, and that's why it needs to be tightly regulated.
And perhaps just remark that all marijuana is not the same, and marijuana you buy in the street is often of unknown quality, of unknown species, and not necessarily the kind of medical marijuana that you're looking for that you could get through a regulated dispensary system.
And finally, Chair, the status quo right now is that everything is black market. There is no legal way for patients to obtain their medicine at the outset. So we are starting from a complete black market. We would like to move to a regulated, safe system for patients.
And at the same time, you don't want the regular market leaking stuff to the black market. So that's why we are concerned with tracking systems, like how we did with pseudoephedrine not too long ago, where we know how much something's suspicious when you're buying so much at one day. That kind of tracking system, and removing it from the patients and the caregivers from growing. That way, you have a really accurate system, regulated system. Trisha.
And Chief Kubujiri, last comment.
Yes, Chair Rose, I just wanted to add that, this is pretty unique in the sense that we don't this is supposed to be medicine. And that being said, we don't have our citizens growing their own poppy. We don't have all of this. We wanted the HCR 48 was to look at the entire picture, and we wanted to take out the contaminants, make it safe medicine for those people that qualify for, is given a recommendation that medical marijuana would help them. We don't have those safety components built in to people that grow on their own, the black market, and the dispensary was to make and to test for the purity, the levels of THC, so that it can help these patients.
I couldn't agree more, but it seems to me like that makes the argument for having the dispensary. So anyway, I'll stop there.
Okay, members, I do want to take this opportunity to publicly thank, and this is being broadcast online as well as statewide, to thank the members of the task force on the other side of this table who have done a tremendous amount of work and service for our state, because I think we're going to be moving forward in a very positive way. So let's thank these Thank you. Now we're going to go through the testimony that we have, and we have numerous testimony on 321. Again, we have copies of the written testimony. All members will have it. It will be posted. We ask that members of the public who want to amplify their testimony, that they are welcome to do so. But again, we do have many other bills on this agenda, and I want to thank your attention and your participation. So first up, we have in opposition, City and County of Honolulu Police Department Captain Jason Kawabata.
Good morning, Chairman Lottie, and Vice Chair Buenaventura, and members of the committee. Honolulu Police Department opposes this bill. We have a few problems with the bill. One is it prohibits candy but allows lozenges, but the lozenge is defined as small tablet manufactured in a manner to allow for the dissolving of its medicinal and therapeutic components slowly in the mouth, but forms of candy can also fall into that definition. We want to make sure that we don't have it in forms that would be attractive to children. It was mentioned before, people allowed to grow on their own, and I'm thinking for a dispensary causes regulatory problems. It's a different forms of marijuana that really concern us also, because if it gets into the wrong hands, if children have access to it, or even pets, we've seen that in Colorado where increased incidents of accidental ingestion by children and pets. I think a lot of our concerns really could be addressed with certain changes, just in what qualifies as a debilitating medical condition. For instance, if the severe pain could be associated with some kind of condition that could be diagnosed, such as cancer or HIV or AIDS, if it could be tied in somehow, it'd be less probable for people to abuse the system. Thank you.
Thank you, Captain Kawabata. Next up, in support, Samantha West of Epilepsy Foundation.
Thank you, chairs and member of the committee. My name is Samantha West, and I am the executive director of the Epilepsy Foundation of Hawaii. I'm also here on behalf of the National Epilepsy Foundation. And I stand by my written testimony in support of this bill, but I also wanted to bring up the idea of the amount of patients that actually would qualify for this. So epilepsy is a qualifying condition to gain access to medical marijuana, and there are over 13,000 people in the state of Hawaii with epilepsy. So currently, a lot of the physicians we work with feel very hesitant to prescribe it because there is no dispensary system. So with a dispensary system, our physicians would likely be able to actually give more access to the patients who could really benefit from this life-saving treatment. Another thing I did want to note is that with epilepsy, A lot of times people don't realize there's actually, there is fear of loss of life from having recurrent seizures. So this treatment actually could help them if their physician does deem it necessary.
Thank you, Ms. West.
Thank you.
Members, as just a matter of kind of housekeeping, we are not going to be making any decisions on these bills today. We will be deferring it to another time. So, and that's for the committee as well. We'll be taking all of this testimony under advisement. So if you're sticking around to hear a vote, that will not happen today. Next up, we're going to have Public Policy Voice for Roman Catholic Church, Walter Yoshimitsu, followed by Hawaii Family Advocates, James Iona, followed by Community Alliance on Prisons, Kat Brady. Good morning, Mr. Yoshimitsu.
Good morning, Chair Bellotti and members of the committee. I'm Walter Yoshimitsu with the Hawaii Catholic Conference, making comments about the concerns that we have about several bills, this being one of them, and in my testimony I talk about other bills as well. Aside from the fear of abuse and the like that I point out, I've listened to the testimony before you, and the same question, who, what, where, when, how, and the like has not been settled. And so what I would suggest is that, and I heard that in several other testimonies, that give us some time, let's do it right. I think that what has come out is that we need to regulate the dispensing of medical marijuana. It's just that we don't have, in my opinion, any adequate rules to safeguard what is happening, the safeguard to the abuse of medical marijuana. So I would suggest that we take some time, put on the brakes, look at Colorado, look at the other states that have been, what have they done, what have they learned, and then come up with the best policy that we can. Thank you.
Thank you, Mr. Yoshimitsu. And thank you for your testimony. Members of the public, if you come up and would like to, as Mr. Yoshimitsu did, notice that he has submitted testimony on multiple bills. We're going to go through all of the bills, but if you wanted to just, if your testimony is duplicative, we can also help facilitate by moving through it that way. Okay, so next up we have Hawaii Family Advocates, James Duke Iona, or his representative, followed by Kat Brady, Community Alliance.
Testimony and strong support.
Okay. Next up, we have in support John Backle, Americans for Democratic Action, to be followed by Tracy Ryan of the Libertarian Party, both in support. Seeing neither of you here, moving on to Hawaii Cannabis Care in support, followed by in support Americans for Safe Access Big Island Chapter, Andrea Tischler. In support, we have Malama Min, Vice President of Hawaiian Standard.
Hi.
Oh, good morning, sorry.
Good morning, Chair Bellotti. Good morning, Chair Rhodes and members of the committee. I really want to thank you for introducing this measure, so thank you. A medical cannabis system a dispensary system is badly needed here, so thank you for recognizing that need and introducing this measure. I strongly support this bill. We strongly support this bill. Overall, it's thoughtfully crafted and in large part to the work of the task force. I think that we've worked really hard. I think there's lots of people that have worked for over a decade on this, and I don't think that we need any more time. What we want is safe access for patients. I have a few comments. Section 321-H6 requires the department to establish a training and certification program for dispensary employees. I feel like this may be too big of a demand for the department. We don't object to training and certification. We want training and certification. But given their numerous other responsibilities, we would suggest that this burden be shared with the operators as well, so that we can take some of that burden off of the department. And also, I agree with ACLU that a 6-month time period for manufacturers or for production centers, I'm still getting used to the language that's in the bill. For the production centers, 6 months from getting your license to being able to provide to dispensaries might be too short of a time period. Maybe moving back the licensing for the production centers a few more months to get ready, because they're going to need to be able to procure and cultivate enough medical marijuana. They're going to have to retrofit facilities, train and get all of the security measures up to code, and also train and hire employees. And I think 6 months is too short of a period for that. So that would be my suggestion, to maybe push back the licensing for the production centers ahead of the dispensary opening, so that there's enough time to properly prepare. And I did want to make a comment about the amounts. There's no known deaths caused by marijuana. So I think that the amounts might be better determined by what we're talking about through the physician deciding how much a patient should have, and doing it through the a regulated system where each dispensary can know what the patient was prescribed, what amounts were prescribed, and what types by their physician, and they can have that on a database rather than creating an arbitrary amount for everyone that might not be right for every patient. And also, we're also very concerned with safety. We don't want anyone blowing up. We don't want anyone consuming products that are have chemicals added to them or are not safe for consumption. And this is why we really, really want and need a regulated system. Thank you again for your time. Please pass this bill very soon.
Thank you, Ms. Min. Dr. Myron Burney, Natural Cancer Wellness. Stephanie McNamara, Coloco Rentals. Gary Shimabukuro of La Lima Pacific, Inc. The last two were in opposition. Okay. We're now moving into the individuals. So we have in support Marissa Sugano, in support Farron, in support Alfred Maderos, comments Kay Miley, in support Robert Bacher of Green Futures, in support Brent Neal, Marilyn Mick in support. The following are all in support: Ronald Taniguchi, Vincent Kimura. Thank you, Chair Rhodes. If your name is called and you want to come up, please note and just come up, and you are allowed to testify in addition to the written testimony that has been submitted. Ms. Wailua Brandman, Terry Heedy, Geraldine Miyagi, William Zastro, Chris Kobayashi, Dr. Kimberly Turnbull, Robin Temple, Aaron Kay, Beth Grech, Diane Kusaka, Dominic Lucia. Further in support, Javier Mendez Alvarez, Jennifer Tevez, John Rosner, Joseph Bobich, Kathy Shimata, Keola Griep, Lacey Shimabukuro, Mark, Natural Man, Reed Konashiro. If I'm calling your name and you happen to be standing outside or sitting outside, please, you can still come in and testify if you would like to, or if anyone in this room called out your name, please realize you can come up and testify. Stephen Ogata, Terry Ann Suruya, Victoria Leitzner, Wayne Miller, Wendy Gibson, Kurt. Any Kurt here? I'm going to turn this over now to my co-chair.
Okay. Frederick Menscher in support. Zachary Lee in support. Jane Sagano in support. M. Min in support. Rebecca Young in support. Come on up. Thank you. After just say what are we now? It's still morning.
Aloha all. My name is Rebecca Young, and I am testifying in support of the bill. I am a master's in social work student, but I'm also here on behalf as an individual in support of the bill. It's obvious that not every bill is perfect. There's no way that we draft up a bill and it's perfect. Obviously, there need to be adjustments. And while I would love to speak to the black and white, cut and dry policy side of this, I believe many others have. Not to mention that I am new to the process. I am learning this side of it, so I can only appeal to the personal side of the medicinal marijuana. All it takes, I've always said this, all it takes is to know one person personally who is suffering from debilitating pain, who is taking 57 narcotics and cannot stomach them, who cannot sleep, who cannot eat, who cannot relax. But the only thing that helps them is medicinal marijuana. All it takes is to know one person that has to use that option. I appreciate and deeply appreciate the fact that this bill is being considered and that the fact that we're trying to implement a legal system of medical marijuana dispensaries. Thank you.
Thanks very much. Next we have Jessica J. Lung in support. Keone Ward in support. Come on up. Come on up. Keone?
Yes.
Okay. Morning.
Good morning. I just want to say thank you for having me, Chair, and the rest of the representatives. I kind of agree with this young lady back here that all it takes is one person, and to know that one person that needs this medicine. And I think that would definitely change your views. Not that you have any particular views now, but I have a father who was, unfortunately, he passed away December 9th, 2014, but I gave him medical marijuana. He was given by the doctors hundreds of, I don't want to say hundreds, lots of pills to help deal with his stage 4 cancer. And morphine was one of the biggest ones that he used daily. And I found that me being able to some days not give him morphine and give him edibles, we had a more of a relationship. I don't know if you ever seen anybody who takes morphine daily, but they're not all there a lot of times. So what medical marijuana did for us is that it allowed me and my grandkids to spend more time with them, quality time, and for us to continue to wait, and to continue to not take care of these patients is just gonna. Those people are not going to be around in 2 years. I mean, there's people that could use the medicine today that in 2 years they may not be around anymore, and we got to really think about that. I mean, I know there's going to be consequences and bad people are going to do bad things with it, but we have to realize why we're here. We're here to give safe access to these patients, and my dad is a perfect example of that. We need to do it today, and we need to do it for those that may not be around later. So that's why I'm in support of this bill, and I'm also highly in support of Bill 1455, which will give us or give people like myself the avenue to help these patients today. And that's why I'm here. So I thank you for your listening. And if you have any questions, I'll be here.
Great. Thanks very much. Next is Pat Mihara in support. Next is Melissa Kaunohi Comment in support. Mike Ruggles in opposition. Brittany Neal in opposition. Dee Nishihara in opposition. Nora Ng in opposition. Gary Shimabukuro, I think that was called already, in opposition. Judy Lavi, opposition. Lila Albano in opposition. Lolita Takeda in opposition. Marcia Nakadone in opposition. Mary Smart in opposition. Marion Shimabukuro, opposition. Susan Duffy in opposition. Todd Takeda in opposition. Yoshimichi Takeda in opposition. Bobby Pang in opposition. Harvey Lee in opposition. Jonathan Barkley in opposition. Lisa LeBrun in opposition. Marina Nishimura in opposition. Ricky Shimabukuro in opposition. Rogelio Herrera Jr. in opposition. Okay. Mr. Herrera? Good morning.
Good morning, all. Chairs, vice chairs, members. Submitted written testimony standby. Just want to amplify a little bit. Father of 11 kids, 8 of them go to public schools here in Hawaii, or will graduate from public schools here in Hawaii. And we've got a real challenge out there at the educational level. And we had a DARE program, and the DARE program has been scaled back. And we're out there trying to tell kids, what's to be concerned about as they grow up with regard to drugs and that environment. If we're going to now call marijuana, and I'm very sympathetic to this medicine, then we're going to have to look at some way to help kids process what was, quote, bad and not good for them now is medicine. And I would just, maybe in some way in legislation we can put some sort of protection in for our children education-wise. It's a leap that we're taking, and I just want to make sure that we don't lose a generation of kids who are trying to process this, and we have not provided them the information they need. Thank you.
Thank you very much. Next up, we have Terry Lindquist Bunkley in opposition, and Kenny Westig in support. I believe that's all the written testimony we have. No, there's more. Okay. Go ahead.
Yeah, I can.
Okay, good.
All right. Testimony, and this is received late testimony in opposition. Maui Police Department Chief of Police Tivoli Fa'aumu. Good morning, and thank you for joining us today.
Good morning, Chair Pilati and Chair Rhodes, and the member of the Health and Judiciary Committee. I am Chief Tivoli Fa'aumu, and I am here to represent the Maui Police Department. Thank you for the opportunity to testify on this important bill that could affect the quality of life in our community. You heard testimony today, and as far as the Maui Police Department is concerned, we do sympathize with a patient that approved to use medical marijuana. And we understand the issue regarding this. But what we have right now is the gentleman that testified before me basically look at the fabric of our community, our ohana and our kids. We talked to them about illegal drugs and things like that. And now we look at it and we tell them that now is a medicine. It is something that we have to. I had attended some of the conferences that Chief Kupajiri mentioned, and we listened to representatives from other states that basically said, look into it, do a good research, be smart about your decision, because once you open that gate, you can't take it back. The consequences will be harder on you to recover from what the decision that you make today. We do understand that there are people that need medicine, and we do sympathize with that. But today, all we're asking for is we need to make a right decision on this. We know that here in our state, we do believe in the spirit of ohana, our family. That's what we're looking for. And our decision that we make today will be the future of our ohana, the future of our kids that will take us to the next generation. Thank you for your time, and you do have my testimony.
Thank you. Yes, we do. We have comments from Alan Johnson, Hawaii Substance Abuse Coalition. Testimony in support, Hawaii Safe Access Group, Kay Bullard. Testimony in support, Pamela Lichty, Drug Policy Action Group. Good morning.
Good morning. Still morning. Good morning, Representative Bellotti and Rose and members of the committee. I'll be very brief because you have my written testimony. I'm sorry that it's late. I wanted to just highlight a couple of things that I don't think have been mentioned elsewhere or and a couple of additional comments. First of all, I agree with Mr. Herrera about the need for education. There was discussion at the task force about the Department of Health specifically having an educational component. Their whole idea is that it's a public health program, and therefore they should have public health education to the general public and to our youth as well, to talk about the issues that we're all concerned about. So we are supportive of that. But I know you were all very supportive of little Miley, the child with Dravet syndrome, but I want to also have you think of the scenario of a 73-year-old woman who's just been diagnosed with cancer and is told that she has to start chemotherapy the very next week, which is not an unusual scenario. And to tell this woman that she has to start growing or find a caregiver, within a week is simply, in my view, cruel when it's something that could definitely help that person. I wanted to mention, too, or emphasize
that of the 23 states plus D.C. that now have some sort of medical cannabis program, we are the only one, I believe, or maybe one of two, that doesn't have some sort of dispensary system either in place or enacted and coming down the pipeline. So I think this is really an embarrassment for a state that was one of the pioneers in enacting legislation through this body in the first place 15 years ago. I want to also emphasize, and somebody's touched on this, that what we're doing is trying to replace the existing black market with a regulated market. And it's not like we're creating a brand new market that isn't there, and the demand for marijuana continues undiminished. It's a matter of who is going to regulate it, if it's going to be regulated, and who's going to do that, criminals or our state. And finally, I wanted to remind you, if you have forgotten, that last year there was a comprehensive survey done of registered voters in Hawaii by QMark Research, a well-regarded firm here in Honolulu, and they found that 85% of Hawaii voters support a dispensary system. I can't think of another issue in which you get such widespread support. So I'd just like you please to bear that in mind as you make your decision today. And again, thanks for all the hard work and for hearing this measure today.
Thank you, Ms. Lichty. In opposition, Hawaii Building and Construction Trades Council Reginald Castaneras. Comments from Hui Kahu Malama Puhipono, James Anthony.
Good morning, chairs, committee members. My name is James Anthony. I apologize. My testimony last night was late. I assume you'll get it eventually. I have it on paper. I also submitted additional testimony.
We do have your testimony. So.
I submitted a one-page of additional testimony just suggesting a few amendments to the bill. Just briefly, I am a California land use attorney and formerly an Oakland City zoning prosecutor. I was born and raised in Hawaii. I'm living in Oakland now. I did have the opportunity both to address your health committee in the last session and to address the task force later last year. The task force did an amazing job in a very, very brief time. I've been studying medical cannabis and practicing medical cannabis law for 9 years, and I still learn new things every day. So we are well on our way, though. I would say the three issues that I would raise in my additional testimony, specific amendments, are, number one, there's I've heard it said that somehow you cannot legislate a local preference in licensure, and that's simply not true. In my testimony from last night, I give you the sections of the legislation from Colorado, Nevada, Oregon, where they do that specifically. They give some preference to local residents, either with a track record in medical cannabis or a track record of supporting good work in the community. So that is something that I would urge you to clearly allow the department to consider. The other thing I think you should give the department power to consider is sort of the other side of that. I mean, there's one thing, it's local preference, but the other thing is consideration of out-of-state patients. And I want you to picture in 2 years, we could have a situation where duty or good work, local patients can go to a store and avail themselves of a wide variety of different strains and different modes of medical cannabis. Meanwhile, the medical cannabis visitors from out of state who are concerned about traveling with their medicine get here, and we say, sorry, we can, but you can't. And that is not only cruel, it's frankly shameful. So I would urge you to empower the department to offer recognition and service to out-of-state patients as a matter of medical hospitality. And finally, in my testimony last night, I quote a 2010 Office of Hawaiian Affairs report called The Disparate Treatment of Native Hawaiians in the Criminal Justice System. And it makes the very clear point that as part of the astronomical escalation in incarceration in this state and many others, that Native Hawaiians are disproportionately represented at increasing levels at every level. They get busted more, then they get prosecuted more, then they get convicted more, then they get sentenced more. So I want you to think about that, because we've got decades of that now, right?
Mr. Anthony, I'm going to ask you to wrap it up. That's very good things to think about.
So all I'm saying is that if you have a felony exclusion, you are going to perpetuate that injustice, and you are going to exclude from this system people who have already been harmed by, interaction with the state. So consider modifying the felony exclusion, and I have that in my additional testimony. Thank you so much.
Thank you, Mr. Anthony. We have late testimony from individuals. It's both in support and in opposition. So if you hear your name, please feel free to come up. Alan Yoshimoto in support. Angela Breen in support. Arvid Youngquist in support. Barbara Berry in support. Brenda Cloutier in support. Bryn Villers, opposition.
Morning, Chair Bellotti, Chair Rhodes, members of the committee. My meter's about to expire, so I'll try and make this as quick as possible. I'm going to run through a couple of things on the bill itself and then just a couple of questions really quick. So the first one that I had is under Section B. I believe this was mentioned before, but it says not less than 26 dispensaries shall be licensed. I would humbly suggest that be changed to may or will be offered. Otherwise, it may put the state in a position where there's fines that have to go through, or they're forced to expend extra funds to force dispensaries to be opened.
I'm sorry, sir. What is your name?
Bryn Villers.
Bryn Villers, and you're testifying in opposition?
Yes, ma'am.
Okay.
The next is, let's see, it would be under subsection H, down at point number 9. It says dispensary and production center inventory controls to monitor unauthorized diversion, etc. The question that I have associated with that, or the consideration, is that if you have folks who are actually working at the dispensaries, and this is not to impugn their character, but how are you to prevent people from being able to remove small sections of the marijuana buds from the marijuana that's being produced and then transporting that outside the facility? It's just a generalized question. How are you able to monitor the production of the marijuana plant at each stage through its growth? Just a little bit further down in 10, it talks about the enforcement of prohibitions. I would suggest that if this is going to go through, that perhaps the ramifications from breaking the law associated with people who are working in these facilities, if they're ever found to be breaking the law, that the penalties and fines would be doubled, similar as if you're passing through a construction zone and there are construction workers working there. If you're speeding or if you cause any kinds of accidents or do things illegal within those zones, you double the fines, you double the ramifications. Let's see. And in addition, there are tools that have been produced now which allow law enforcement officials to be able to test for marijuana intoxication in an immediate state. And so if someone is, for any reason, pulled over or is associated with operating machinery or operating a motor vehicle, that the law enforcement would be provided with tools to be able to test them to make sure that they are not intoxicated at that moment in time while they are actually operating a vehicle or machinery. Under subsection I, it says, no medical marijuana production center or dispensary shall be permitted within 500 feet of the real property. I would recommend that would be changed to yards instead of feet. 500 feet is not that far, and to have it close to a public school or any other public facility is a little close. And in addition, to add not just a public school, but also a private school. Both of them are housing children within them. I believe that's all of the bill issues that I had specifically. In addition, I wanted to ask, how is this going to change the state's liability? Is the state going to be liable for medical marijuana being out accidentally dispensed to children in some way, shape, or form? How does the state stand according to that?
Mr. Villers, can
Yes.
you wrap up? And I would just note, in your testimony, we appear to have just the cover sheet. So if you could make sure that your written testimony in full is submitted, that would be helpful.
Okay.
If you
Sorry,
have
it was late and I basically submitted it right before you folks started your thing today.
And if you could just wrap it up, please.
I sure will. My last two things that I would like to suggest is one, unmarked dispensaries. Instead of actually having large signage and everything advertising the dispensaries, have the dispensaries unmarked and disclose their location to the folks who are going to be using these locations so that nobody inadvertently would be desirous to go towards them and there's not advertising. And lastly, mandatory monthly or bi-monthly drug testing for the owners, operators, employees of dispensaries and production centers so that you can make sure that they are not, again, not to impugn their character, but make sure that they're not using the product themselves if they're not already available for medical marijuana. Thank you very much for your time. I appreciate that.
Cheryl Whitbeck in opposition. Next is Cheryl Toyofuku, also in opposition. Christina Marshall in opposition. Oh, hi. I'm sorry, you were...
In opposition.
I'm sorry, your name?
My name is Cheryl Toyofuku.
Toyofuku, thank you. Go ahead.
Thank you very much, Chair Belatti and Chair Rhodes and the rest of the committee. I'm in opposition to HB321, and I just, because there are so many concerns and questions, I'm pretty surprised at how, this is the first time I've come to a hearing on Saturday and how fast-tracked it seems to be for this bill. I understand as a mother, as a grandmother, as a registered nurse, and as a health advocate, and I'm a former oncology certified nurse, so I do have, and it's required as a nurse, you have the compassion for those who are at end-stage diseases, but I am concerned about a lot of the provisions in this bill. It seems that there is a lack of a tracking system that will keep our communities safe, that may pose the possibility of it migrating to recreational marijuana. I do feel like with the multiple dispensaries, that's going to be more availability. The law enforcement questions come into play. I'm also concerned about the provision that said about the 500 feet from a dispensary for public schools. What about private schools? What about daycare centers? What about public libraries? There's just so many questions and concerns as a parent and as a health advocate that I have. Also because, with what I've done, I'm not an OCN anymore, oncology certified nurse, but I have transitioned to a more natural, non-toxic mode of health care. And it just seems that the root causes of diseases now are not being addressed. And I have compassion for this little girl, but the multitude of pharmaceuticals, drugs, and chemicals that she's on, and now to add on another thing to her body, her little beautiful body. So these are just some of the things that I'm concerned about, that there seems to be a movement with other states too, nationally, from medical marijuana to even legalizing marijuana in general, recreational marijuana and so forth. So that's the concern for my ohana and the keiki that I love so much. Thank you.
Yeah, thank you. Testimony in opposition, Christina Marshall. Testimony in support, Courtney Brutch. Testimony in support, Daniel Sugano. In opposition, Danny Milton. In support, Dara Carlin, M.A. In support, David Jessup. In support, David Sugano. In opposition, Ferdinand Mossman. In support, Jean Dollar. In support, Hector Hoyos. In support, Joan Hartfield. In support, Judah Lum. In opposition, Carrie Benez. In opposition, Carla Philbeck. In opposition, Carrie Villiers. Comments, Christy. In support, Kylie Matsuda Lum. In support, Larry Caldwell. In opposition, Leigh Lermont. Opposition. Go ahead. Good afternoon. Thank you for joining us and being so patient.
Thank you for coming up with a bill that at least addresses processing.
And I note that your testimony is in opposition to actually numerous bills, so 321, 788, 1455, 794, 795,
But
and
I'm
992.
addressing particularly the main bill, 321, okay? Chair Bellotti, Chair Rhodes, and members of the Joint Committee on Health and Judiciary. My name is Leigh Learmont, and I'm a resident of Wahiawa. I am testifying in strong opposition to all of the measures on today's agenda pertaining to medical marijuana and marijuana for the following reasons. There should be enough time to educate physicians about marijuana and their uses, what they can use marijuana for, including the dosage, and if it would conflict with other medications taken by the patient. They should also be aware of their side effects and any precautions like other medications, because they're the ones that would be sued, right, if they were prescribed wrong. Also, there should be educational courses for the growers, manufacturers, and dispensers, ending with certification and a continuing education program. If marijuana is to be used as a medical prescription, it should be treated the same as any prescribed drug. The state monitors need to be experts about marijuana to be able to monitor the dispensaries, pharmacies, growers, and the manufacturers so they can adequately monitor all those involved with marijuana. For a number of dispensaries, what percentage of the population is on medical marijuana that we need so many dispensaries? If the patients have not been registered, how do you know how many are on marijuana for medical reasons versus for comfort and recreation? There needs to be strict policies regarding when a person should not be on marijuana if they may endanger their lives or others. I would hate to have a surgeon operate on me under the influence. If I were an employer, and I used to be in human resources before, I would worry about workers who drive, operate machinery, having to have and not having a alert mind in their jobs. So I'm really concerned about from the employer's point of view, because part of the bill addresses giving an excuse for anyone with marijuana in their blood test from employers, but it depends really what kind of work they're doing and what the problem is. Can all of the above be accomplished by January 1st, 2017, especially for the physician's education? These bills pose serious questions that should be addressed before enacting any legislation this year. For these reasons, I respectfully ask that you hold all these measures.
Thank you, Ms. Learmont.
Thank you.
In opposition, Leslie Jones. In opposition, Leslie Jones.
Good afternoon. Good afternoon, Chair. Thank you very much. I did submit testimony on, I think it was a little bit late. My computer, I'm not
We
sure.
have it in our...
Do you have it? Okay, great. So I'll do a summary for you. Basically, my testimony is in opposition to the bill as written, just because I believe there are some negative and yet foreseeable unintended consequences. So just to do a quick summary through here, I think to Representative Thielen's point, we do very much want to help people in medical need, but we need to do so wisely. And I haven't heard a lot of discussion about how to separate between the recreational aspects of marijuana and the medical aspects in the sense of the chemical difference. And I understand that there is a substance, cannabidiol, that is specifically medically applicable but doesn't have the recreational and psychoactive properties of THC. So I would suggest that we have the physicians and other perhaps members of the task force look at that a little more closely so that we can focus on helping people medically rather than worrying as much about the law enforcement aspects. Let's see, in terms of protecting our citizens against unintended consequences, in terms of my testimony, I draw from the experiences in Colorado, which passed a similar law in 2009. And just to give you a couple of highlights from that, some of the problems that they've encountered include traffic fatalities for people testing positive for marijuana use increased 100% since they've passed that legislation. Youth marijuana use for the ages 12 to 17, which I know Alan Shin from Drug Free Hawaii can speak to perhaps better than I, increased 39%, higher than the national average. Emergency room admissions have gone up 57%, just for marijuana-related use. Hospitalizations related to marijuana use increased 82%. Exposure to children ages 0 to 5 increased 268%. They've also tried to, they've had to try to enforce people trying to export marijuana from Colorado to other states by a factor of 397%. And also through the U.S. mail, which is obviously a federal offense, increased 1,280%.
Ms. Jones, I'm going to ask you to kind of wrap it up now. You
Last
have your
two-
written testimony here.
The last 2 points, the lab explosions, obviously HPD already spoke to. And one thing I didn't hear spoken about is pets being inadvertently poisoned, increased 400% in the past few years from this. So I think we need to make sure we understand the implications of passing such a law, particularly when the THC potency has gotten so much higher. We don't know exactly what the effects are going to be if we don't focus on the difference between the medical and the recreational versions. And then the last point is I think we have a real opportunity to lead in the state of Hawaii as opposed to just following the other legislation that's been passed across the nation. So I encourage the members of the respective committees to do just that. Thank you so much.
Thank you, Ms. Jones. We're coming up to the end of our late testimony, so if there's any other testifiers in the public who did not submit written testimony but want to submit oral testimony, if you could go to the staff on the side and sign up. We do have some sign-ups, so we will be asking for late testifiers. Leslie Jones, in opposition, just shared her opposition with us. In opposition, Marion Logan. In support, Matt Binder. In support, Michelle Tippins. Good afternoon.
Yes, it is. Good afternoon, ladies and gentlemen of the committees, both judicial and health. I submitted testimony online. I do stand upon that testimony. However, I did want to address a few things real quick, hopefully real quick. There are a lot of questions coming up that I feel like a lot of people here in the audience are capable of answering you rather well, actually. I did want to point out something that I found rather striking, which was the 318 people unable to grow medical marijuana that was discussed, I believe, by the prosecuting attorney's office. Is that correct? I do want to point out, because I think that semantics is important here, qualifying patients and registered patients are two different groups. Currently, there are a large number of people, and when I say a large number, we've already had the Epilepsy Foundation testify to over 13,000 people that qualify for this medication in this state. They don't register because they have no source for their medicine. Why get a prescription for a medicine that you can't get? It's a waste of money. You pay almost $300 to see a doctor to give you a prescription for something you can't obtain, or you must grow for yourself without knowledge, without an ability to talk to someone and consult for assistance. In addition to that, I should get to my introduction. I'm very sorry. My name is Michelle Tippins. It's such a compulsive argument. I'm so sorry. I live in Makiki. I'm actually in Representative Biloti's district. I am in the Ahupua'a of Honolulu. I am a U.S. Army veteran. I'm 100% disabled. I'm a single mother. I'm a full-time student at KCC. I will be transferring to UH in the fall. I'm a journalist with a staff position at the Kalana magazine, which is a medical marijuana distributed magazine here on the islands. I'm also a medical marijuana patient, caregiver, and I offer certification support and strain counseling to help people isolate what's actually going to be effective for them in this medicine. There's hundreds, if not thousands at this point, different types of strains, each of which have a different combination of the over 100 cannabinoids that have currently been found. All of these things work together in a concerted manner to address people's holistic symptoms. You're not prescribing things for one symptom, which is why prescription quantity is so hard. Okay, I want to talk about quantity really quickly because I think it's the most important thing addressed. I use between 6 and 8 ounces of marijuana per month for my medical conditions, which include fractured spine, PTSD, and multiple other issues. Miley, that little girl that you saw, that 5-year-old child, consumes 8 times what I do. So the idea of prescribing and legislating a maximum amount for something so qualitative as pain and illness is really outside of reason. That little 5-year-old girl takes in 8 times what I do, and you see her. She's not catatonic. She's not out of touch. And I think that's really important for people to understand is quantity, it's not the same as prescriptions because we're not taking out one isolated active component. I want to thank you very much for your time. Have a good afternoon.
Thank you. We're going to keep continuing. I just want to make a note. We were informed by the Sergeant of Arms that while the parking signs say parking enforced Monday through Friday, I apologize for not announcing this sooner, but it is not enforced today, so today parking is free. So if there are folks concerned about it, it's free parking at 12 o'clock. All right, we'll continue. Testimony in support, Reverend Claudia Charters. Testimony in support, Senny Forrest. In support, Stanley Koga. In support, Stuart Saito.
My name is Stuart Saito. Come from Canary District. Good morning, committee. Yeah, I'm in support. My parents died about 3 years ago. My dad chose to make me his caregiver. My mom chose not to use because she had grandchildren in the house. But, you know, when they gave the prescription and you go and you ask them, so how am I supposed to get this? They tell you basically you're on your own. You have to figure it out on your own. We need something out there to help these people when they need it. Because a lot of people, like, you know, they're saying they need it, they can't wait years to get it. And on the, you know, on the enforcement side, ever since I was a kid, you know, supply and demand. If you really want it, even as a kid, you're gonna get it. Make it so that the medical people that really need it have their option to get it without having to go that route. That, like they said, you know, they know the properties of it, you know, if there's any contaminants in it, how clean it is, what goes into it, what comes out of it, and make it safe for the people that really need it. And, you know, a legal dispensary system is, we're not talking about recreation. So it's not like anybody is gonna go and get it. And a lot of adults are responsible enough not to put it in the hands of their children. Thank you.
Thank you, Mr. Saito. Members, that's the end of the testimony that was submitted online. We have Dr. Daniel Susat, if he's still here in the audience. Thank you for joining us.
Aloha. I've been a medical doctor for 35 years, trained here in Hawaii, and I want to repeat what Malama Min said. You know, cannabis has been with people 10,000 years, never killed anybody, except maybe through law enforcement. And Mai Li Jen is one of 10 patients I have under 10 years of age who have gotten remarkable improvement in their seizures, their autism even. And it's I just want to encourage that this happens sooner than later. Thank you. The dispensaries.
Thank you. Dr. Christopher K. Camarillo.
Does this bill have any effect on AIRFA? American Indian Religious Freedoms Act? You guys are just trying to like regulate something with the GET or how to make money off of dispensaries? This is a question. Can I get a response, please?
Sir, this is your testimony, so if you'd like to spend the next minute and 30 seconds asking questions.
Does this have anything to do with AIRFA? American Indian Religious Freedom Act. You guys are talking about a drug and medical this and medical that. I have a religious freedom to practice what I use, a plant. A plant that was given to me. You didn't create the plant. You have no right to tax it. You have no right to tell me how I'm going to distribute it. As long as I follow my religious beliefs that I am not going to harm somebody or myself. And that is protected federally, state, and locally.
Thank you.
Thank you. Mr. James Terrell Trice in support.
How are you doing?
Good afternoon.
I hear a lot of testimony against, and I understand the arguments, I really, really do. A lot of the things that they're asking and they're questioning, though, are, for lack of better terms, common sense. As far as unmarked dispensaries, I'm from Sacramento. I've been out here since 2003, stationed out here, combat medic, Schofield, 2 deployments. There's many classes to educate people on medicinal medicinal cannabis. And people really need to stop calling it marijuana, because marijuana and cannabis are not the same thing. This isn't from Mexico, and this isn't some illegal drug that we're receiving from some other country. This is local grown hemp. Also, Hawaii was the first state to allow medicinal marijuana. No dispensaries. How many years ago was that? There is no place, if you live here on island or any other island, to live as a grower. You can't put that on your rental agreement. You can't tell people that if you're growing your own medication. They won't let you live there. Trust me, I've tried it many times. I'm a patient myself. Also, I heard somebody say to separate between recreational and medicinal use. That's kind of cut and dry exactly what it is. If you're a patient and you have a card and you're carrying, you are allowed to have. For recreational use, that's not even a part of this conversation right now. That's not what we're here for. There's patients, they're responsible adults, veterans. Again, they're patients that should underline the need and the necessity of this. That means they are legally allowed to have it. So understanding that, why are there no dispensaries here at all? And Hawaii was the first state to allow. That's severely confusing. Also, that means that none of these people should be facing punitive charges, since none of them are criminals, since this is their legal medicine to have. So again, this conversation, I don't understand it. If we're supposed to have it and it's legal for us to have it, then it's ours. There's no debate on that. That's cut and dry, black and white. That's the law.
Mr. Trice, can you just wrap it up, please?
Gladly. I feel there are a lot of people who are misinformed. And honestly, looking around, it's because they fail to choose to actually look for the knowledge and the answers. There are many answers out there. There are many websites I'm sure you've seen. And all the information is there. But you can't force somebody to look up the answers. And a lot of people are scared because on the news they portray it as an illegal drug substance when it's in fact their medication. A lot of that needs to get cleared up. Not your fault, not our fault. That's the way the world works. Again, sorry for taking up all your time talking, but thank you for allowing me to testify.
Thank you for joining us today. Testimony in opposition, Daniel Nair.
Good afternoon, committee members that are left. I oppose this for 2 reasons. The first is for 15 years of half-hearted, not attempt to do a little to perpetuate their superiority and their job for the legislature and to give them something to do for another 4 or 5 years. Second, why cannot it be dispensed by the original or the people already authorized to dispense controlled substances? Thank you.
Thank you, Mr. Nair. Testimony from Dan Langford. Good afternoon.
Hello. I am the owner and operator of Ohana Greenhouse and Garden Supply, and I am a blue card holder. I own garden stores on the Big Island, Maui, Oahu, and have a sister location in Kauai. I fly in between the islands 60 times per year to maintain my businesses. Over the last 10 years, I have advised thousands of blue card holders on how to grow medical marijuana. These blue card holders are our Ohana and our neighbors, citizens of Hawaii that come from all walks of life. I cannot express the amount of difficulty these blue card holders have had at consistently growing medical grade cannabis. Growing the plant properly is a science. For the average patient, the odds of successfully growing a consistent and adequate supply of medical grade marijuana is less than 50%. Growing marijuana takes time, 3 months at a minimum. Bugs, disease, weather, theft, genetics, inconsistent gardening practices are all challenges that people wishing to grow their own medical cannabis face. There are thousands of people in the state who have held a blue card but not renewed solely because of the difficulty of growing the plant. I can also testify that the number of blue card holders that have not been successful at consistently growing medical marijuana is in the thousands, not in the hundreds. These patients need help. Dispensaries should be there to provide medicine for those who cannot grow their own or for the patients who cannot produce an adequate supply. I believe that the need for the dispensaries to sell live plants has been overlooked. The chance of a success of a patient successfully growing their own medical marijuana is greatly increased if they are given a healthy plant that is entering a second stage of growth. Dispensaries need to be allowed to sell live plants. For many, growing their own plant will be the only way to afford the medical marijuana. I'm in contact with blue card holders on a daily basis from all over the state who need the services of a dispensary immediately. We owe these people the right to obtain the medicine that the state has allowed them to be prescribed. Thank you.
Thank you, Mr. Langford. Gino McIntyre?
Good. Is it afternoon?
Good afternoon.
Good afternoon. I applaud you for being here on a Saturday and starting this at 10 a.m. because we all kind of want to chill. But I wanted to say that I'm in support of the dispensaries. It is a little embarrassing that we're behind so many other states, but whatever. First of all, I wanted to say, if I may suggest, and I know it may be a little bit crass of me, but don't listen to the police, especially that they're in opposition. I mean, of course the police are going to be in opposition. That's like having a hearing on whether or not Anakin Skywalker should turn over to the dark side and listening to Siths. You're going to get... well, we all know it's best that he should have been a Jedi. God does not make mistakes. And he smiled upon this earth the day he made marijuana for our consumption. And it does help. I myself used to, in my teenage years, it's crazy as hell. I was on Depakote, Wellbutrin, Paxil, all these pharmaceuticals that were messing with my hormones even worse. And then I just started smoking, I don't like to call it marijuana, I started smoking cannabis. And it really mellowed things out. And it made being 16, 17, 18, 19 a lot smoother for me and my grandparents. I had a friend that recently died of a disease the day after Christmas, and I'm proof positive that if marijuana, cannabis was available to him, he still might be alive. There's so much evidence that this is good for us that you almost have a obligation to pass this as something that we need, because we need this at this time. Alcohol is legal. It kills people. Marijuana has killed no one. Okay? All right. Y'all look lovely today, okay?
Thank you. Thank you, Mr. McIntyre. Thank you for joining us. Eva Andrade, Hawaii Family Forum. Good afternoon.
Good afternoon. That was such an awesome thing to follow up with. You look good too there, sir. Representative Bellotti, Representative Rhodes, and members of the committee, we thank you so much for having this hearing today, because the issue of sick people needing their marijuana when it's prescribed to them is an important one. I did submit testimony yesterday. I'm not sure why you didn't get it. I did check with them. They said you have it, and it's the same testimony for all the hearings, so you can just use this for the rest. Our concern simply is this, that we understand you're trying to build that bridge between people that need their medical marijuana and where they can get it safely. But really the bottom line is when you build that bridge, what's going to happen is it is going to trickle out into the community, and our parents in the faith-based community are absolutely paranoid that this is what's going to happen. And so we just ask you to consider that as you're moving forward in the discussions. And we do thank you for the great questions that you asked today. We really appreciate that. So thank you very much and have a great day.
Thank you, Ms. Andrade. Alan Cardenas Jr. Good afternoon.
Good afternoon. Aloha. Thank you for the opportunity to testify. I'm testifying in strong opposition to this. We do need to have compassion and care for our kupunos and our family members that are struggling with pain management. And there's organizations out there that are helping family members to deal with effective pain management. So I just wanted to put that on record. I'm testifying in opposition. One of my biggest concerns is that there may be unintended consequences for the passage of not just this bill, but some of the other bills. And that would be that these bills may be able to provide a springboard for decriminalization and legalization of marijuana. That's one of my biggest concerns. When you look at some of the other states that have been enacted similar bills, decriminalization and legalization followed as well. So that's my biggest concern here this morning. I think a vote for this bill is a vote for decrim, legalization, and that's what our children in mind. So that's my biggest concern. Thank you all for the opportunity to testify. Mahalo.
Thank you, Mr. Cardenas. Patrick Corbett. And he's going to be followed by Jonathan Lance and Noella Nance.
Good afternoon.
Good afternoon.
Chair Bellotti, Chair Rhodes, Vice Chair, members of the committee. Aloha. My name is Patrick, and I'll be brief. I would like to testify in strong support of House Bill 321 with the reiteration of one statement that was made earlier, that it only takes one individual. If you know one individual that deals with many issues that, like myself, that I deal with on a daily basis, the understanding would be very clear. As a 30-year veteran, recently retired, many issues, many concerns for various reasons, and opposed to the numerous meds that they want to feed down your throat on a daily basis that are often ineffective. I, like many other voices that you're hearing here today, simply request legal means to attempt to simply survive on a daily basis. I'm a veteran. I'm not desiring black market, the chemicals, the unknown safeties thereof, and more importantly, the legal ramifications of getting caught up in such a mess. I'm one of, I guess, the 318 or I guess there's 317 more like me. I don't have the knowledge of growing nor the area to have a grow site. So I and the other 317 truly need dispensaries. I would just simply conclude with please pass this bill. Thank you for your time and your consideration, and have a great day.
Thank you, Mr. Corbett. Thank you for your service to our country.
Thank you.
Jonathan Lance, Noella Lance, followed by Azina Powell and Leah Kuntz. Mr. Lance?
Hi. I was just going to comment a little bit more on that 318 number of the patients that have cards but don't have access. I think it's been touched on a couple times, so I'll make it quick. But yeah, a couple reasons why I think that 318 number is probably pretty misleading, and I don't think it would be wise to use it as a guideline for determining the number of dispensaries. I think one thing is with the list of conditions that are currently acceptable to apply for a card, I think that list doesn't include certain conditions that may at some point be acceptable, like PTSD. So we should think about in the future there may be more conditions on that list, and therefore a broader patient base. And also I think Dan touched on it, but just as someone who's involved in horticulture professionally, I think it is important to realize a lot of people who may be growing for themselves right now might prefer to pick up their product from a dispensary if it was available, and just not to underestimate how difficult it really can be to grow and produce your own product. And the capital investment that takes, and you know, as someone, you know, even at home I grow lettuce, tomatoes, all kind of stuff, but most of the time I still end up buying it at Safeway because it is hard to produce something that's free of pests, free of disease, that you're confident that there's no mold or any sort of you know, infestation. And when you're depending on your medicine to have your whole crop of medicine be wiped out by a pest disease, a pest infestation or something is a big deal. So I just want to say I think using that 318 number might be a little, might be a mistake, and we could expect a lot of people who maybe are growing for themselves to still prefer to get their product from a dispensary. Yeah.
Thank you, Mr. Nance. Noella Lance? Nance? Followed by Azina Pau and Leah Kuntz.
Good afternoon. Good afternoon, Chair. Good afternoon. I'm speaking just as a parent. I'm not going to go over any statistics. You've heard them all, and I'm strongly opposed to this, not because of just what the other mom, as a mom, we would do anything for our kids, especially when they're hurting. What I'm asking you, Representative, is please don't make a haste decisions. I'm hearing all of this testimony from the the law enforcement people. We're asking you as the lawgivers, think this through. There were a lot of good questions from you asking the task committee, and it doesn't look as it's been really thought through, like the distance from 500 feet to 500 yards. That's a huge difference. And again, so as a parent, I've said this before, parenting in itself is very difficult. We know that marijuana is a gateway drug. We know that for a reason why it's called that. So again, I'm not against people that really need it. I'm just asking you as lawgivers to really think this through. Take everything into consideration. Because once it's passed, and then it's just trying to hold a dam back. So please, again, as a parent, we're asking you as lawgivers to really think things through and continue asking all those really good questions and have it answered. Thank you.
Thank you. Azina Pau. How do you say? I can't read your name.
It's PM Azinga. That's what it says. 49.
49.
Okay.
What is your name, ma'am?
My name is PM Azinga.
Pia Azinga.
PM Azinga.
PM Azinga.
Aloha. And mahalo for taking time, Chair, and honored member guests and members of the audience. If I were quickly, the human brain has over 100 billion neurons, and each neuron connects with at least 10,000 other neurons. And sitting on your shoulder is one of the most complicated objects in the universe, if I was to take the words of Miko K. At the onset of marijuana abuse, I stand in opposition to all of the options or laws that you are about to purport. As I say, at the onsetting of the marijuana abuse by underage youth, there is an increased likelihood of children becoming addicted. At the onset of marijuana abuse by underage youth, the pathology is irreversible and cannot be cessated even if it's totally completed. At the onset of marijuana by underage youth, there is impairment in cognitive loss, memory loss, muscle coordination, alertness, response time delay, reward, and unmotivational syndromes. At the onset of marijuana abuse by underage youth, there is an increased incidence of mental illness. At the onset of marijuana abuse by underage youth, there is a correlation between marijuana and psychosis. At the onset of marijuana abuse by underage children, there is a strong correlation between marijuana and schizophrenia. At the onset of marijuana abuse by underage youth, there is a strong correlation between marijuana and depression and anxiety. At the onset of marijuana abuse by underage youth, there is a significant disruption of fetal crossing the placenta and blood damage berries. At the onset of marijuana abuse by underage youth, there is an increased likelihood of the addiction manifesting itself into the loss of 6 points of IQ points to the adulthood. At the onset of marijuana abuse by youth, there is as much likelihood, an increased likelihood of students dropping out. At the onset of marijuana abuse, youths have a 16% risk of becoming addicted.
Ms. Nzinga, can you
last
wrap up
one,
and
last one. At the onset of marijuana abuse by youth underage, there is a cannabinoid receptive disruption of the central part of the brain that is 95%. I am absolutely, as a teacher, as an earth mother, I'm totally against us passing this legislature that is suggested at this time. The person who does most research in the United States is Dr. Nora Volkel at the National Institute of Drug Abuse since 2003. Please look up her information as it relates to marijuana's effect on the youth brain. I call them the damaging dozens. Mahalo.
Thank you. Leah Kuntz, followed by Roger Brewer.
Hi, thanks for hearing me. My name is Leah Kuntz. I am a service-connected disabled Navy veteran. I'm also a former substance abuse counselor at a methadone clinic. I've heard a lot of talk about diversion, and so I'm not sure why the model can't follow like methadone clinics where they have inter-island and nationwide and worldwide dosing, guest dosing, I should say. And what that means, you don't have to worry about federal regulations stopping you from carrying anything with you because you can get it where you go. You can be a guest doser at any clinic you can go to. Speaking to the part where if you have like one doctor who's going to give you your recommendation, you should have one dispensary, which is your home dispensary. Meaning and it's going to be a database set up also where you cannot go to different places to get more and more and more to have things diverted. Heard a lot of talk about that, so there should not be an issue with diversion. If you're concerned about where to grow this product at, follow the University of Mississippi, where the federal government does grow marijuana for patients. I don't think they have a real big problem with diversion. I've heard a lot of people mention being faith-based as like part of the reason why they're opposed. I'm actually absolutely for this. I'm 100% positive that this will work. I'm just in total support of all of these bills. I am faith-based. I am a parent. I have raised a very successful child, and she's also a substance abuse counselor at this time. And she also is fully in support also of medical marijuana because it's needed. It's humane. Again, I said I am a disabled Navy veteran. I cannot take pharmaceuticals. I have an allergic reaction to opiates and benzodiazepines. It's kind of a good thing. But medical marijuana does work. So, again, it's just this whole diversion thing. Follow the different programs that are available out there. People always want more and more research, do this, do that. I feel like there's so much research out there. If you would take the time to actually look at it, you wouldn't have to waste any more time and delaying anything else if you just look at all the research available already. You're all smart people. You can look at things and figure out what's needed and what's not needed. So that's it. Thanks.
Thank you, Ms. Kuntz. And last, Roger Brewer.
Thank you. You have my testimony. I submitted, and I'll stand behind
Yes, we do.
that.
I apologize. It was in our testify.
That's okay. I don't mind going last if I am last. So I work as a toxicologist. I'm very familiar with exposure to chemicals and dose response, those kinds of things, just to put that behind. I've never tried cannabis. I have a lot of friends, probably 10% that do. I've never seen them have problems with it. I want to tell you about how your current program is working. So in 2010, I got bit by a tick. I'm not going to go into the details, but look up severe Lyme disease. Go on YouTube or Google, and you'll see what I went through for several years. I'm one of the lucky people who got over that. I saw 5 doctors in Hawaii. None of them mentioned medical cannabis, even though I found out later afterwards, educating myself, that some strains of cannabis have been used for thousands of years to treat chronic inflammation. So I know a lot about pain. Also, another thing I want to point out, that pain is totally different. What kills you is stress and anxiety, and that's why most of the people I know use cannabis. Pain's a different thing. It's physical. It's the mental aspects that can really hurt you. So how can you fix this? For me, there's a strong chance I'll have a relapse. It needs to be fast. I can't. The system now, I have to see a I have to get registered with the state, which I don't have to do for opiates. It's ridiculous. There's 1 to 2 months there. I have to find a grower. That's 3 months to get it grown. They have to cure it. That's another month. I'm looking at 5 months. So I'm dead after 5 months. So the first thing I would suggest to add to the bill is to get rid of the registration program with the state. It's unnecessary. Treat this like a pharmaceutical, like several people have said in support and opposition. I can walk across the street. After 2 years, they gave me prescriptions for narcotics, and I can immediately get Oxycontin, Vicodin, prednisone, naproxen, which I rarely use. That's my main recommendation there. Get rid of the registration program. Unnecessary for this. And then that's all I'm going to say. One other minor point I'm going to say is I've educated myself quite a bit about medical cannabis, how programs are going on in the U.S. It's the picky point. But I noticed in the bill you have grow operations zoned for agricultural zoning only. You should check into that. Look up Lakeshore, Ontario. They're trying to set up some programs there. They want to have it zoned in commercial industrial for various reasons. One is taxes. You can get more taxes off commercial industrial. There's a big lawsuits going on there. So I would take out the zoning and review that for agriculture use. But thank you for pushing this along. I hope I don't need it. I'm not that interested in taking cannabis. And I hope I never walk into a dispensary, but I want it to be there if I do. Thank you.
Thank you, Mr. Brewer. Members, at this time, we're going to take a short recess to conclude, to allow the judiciary members, if they want to clear out. I will note that this bill has a referral to finance, so there's going to be opportunity for continued discussion, as well as when this bill crosses over and we receive the Senate bill. So we're going to just take a brief recess for 5 minutes. We're going to defer till Tuesday for decision making at 8:50 on Tuesday. 8:50 Tuesday. So defer to Tuesday of next week at 8:50 a.m. in the morning.